Eligible students in the nation's second largest school district will now be required to get vaccinated against the coronavirus. It comes amid soaring pandemic cases across the country. Jonathan Vigliotti is in California with more.
The item passes.
Thank you.
Tonight, Los Angeles school board members voted to make COVID vaccines mandatory for all eligible students.
When we look at other immunization requirements, polio, rubella, hepatitis, that we've had in schools for generations, we are going to see other districts follow LA Unified's lead.
I have a number.
The nation's second largest school system will now require kids 12 and older to get vaccinated by Thanksgiving if they want to attend in-person classes. Board member Nick Malvoin says too many school administrators are overwhelmed.
What has their workload been like through COVID thus far?
Well, according to this principal, about 90% of his schedule over the last month of school has been COVID protocols. We're already seeing in instances where kids are vaccinated that we can go back to a normal school day.
Los Angeles County has recorded more than 190,000 COVID cases in kids 17 and under since the start of the pandemic. They now join Culver City, California, and Hoboken, New Jersey school districts, which already enacted vaccine or testing mandates for students and staffers.
I'm in favor of mandating that those people get vaccinated. That's teachers, personnel in the school. In the school, children who are old enough to get vaccinated, 12 and older.
Since classrooms reopened, COVID outbreaks have closed more than 1,400 schools and have taken lives. At least 8 public school employees in Tennessee have reportedly died in the past month after contracting COVID.
Not our kids.
Still, parents like Brenna McCalca, who has a 15-year-old son in the Los Angeles public school system, says vaccine mandates go too far.
This is no one's right but the parent and the child to make.
And the division in schools is also unfolding in homes. The mother you just heard from says her son's father wants him vaccinated. Here in Los Angeles tonight, 40% of eligible students remain unvaccinated, at least for now, Lana.
Jonathan, thank you. For more on all of this, Dr. Bhavna Lall joins me. She is a clinical assistant professor at the University of Houston College of Medicine. Dr. Lall, thanks for being here. So the president outlined 6 broad pillars, mostly things that we've heard before, but some new teeth behind them. What do you make of the president's strategy?
Well, we as a healthcare community, I really welcome the new strategies. I think this is what was needed and very helpful going forward. We have 53% of the country is vaccinated. We really need to get to 85%. We need to continue to increase masking in schools, in indoor settings. We need to make sure that the communities are protected. And the only way we're going to do that is continue to encourage vaccinations throughout the country. So I think it's welcome for the healthcare community. We have people, the healthcare systems and the community is really overwhelmed right now. We really need more people to get vaccinated in order to have our healthcare systems not be overwhelmed, and in order that we can provide healthcare to communities throughout the country.
Oh, as we're talking about these sweeping vaccine requirements that the president announced, including for federal employees and contractors, we're also hearing that the Los Angeles School District met Thursday to vote on requiring vaccines for eligible students. Do you think that mandates are the best way forward for us now?
I do think that vaccine mandates are necessary right now because at this point, we are at a critical state in the pandemic. We have a Delta variant surging, which is 2 to 3 times more contagious. We have hospitals filled, ICUs filled throughout the country. And if we don't get people vaccinated at this point, we're just going to see more hospitals overwhelmed, more people needing healthcare that they're not going to be able to get, and more impact on the economy and schools. We already, in Texas, where I am, we have schools that are quarantining now multiple children, classrooms of children because they were exposed. There's no mask mandates down here. There's no vaccine mandates down here. And we really need to see these areas with low vaccination coverage really improve vaccination coverage and require masks and require vaccines as well.
And even as we are hearing from the federal government these requirements, Dr. Anthony Fauci says that we shouldn't, quote, point fingers at or accuse people when attempting to persuade them to get vaccinated. Tell us what he thinks might be a better approach.
So I think what we need to do, I think what I'm trying to encourage is that we need to, as a healthcare provider myself, we need to actually discuss with our patients and people who are not vaccinated the reasons that they don't want to get vaccinated, and actually describe to them the benefits of getting vaccinated, which include preventing severe disease and hospitalization, and also protecting your families, your communities, your friends, your coworkers, and trying to get our lives back to normal and getting out of this pandemic. So I really think we need to encourage anyone who has not gotten vaccinated right now to get vaccinated. And if you have any questions, please talk to your doctors, to your friends that have been vaccinated, to your family members that have been vaccinated, and really try to figure out what it is that you're concerned about with this vaccine, because we know that it's effective, we know it's safe, we know it's been given to millions of people around the country and the world, and we need to get these misinformation campaigns out, and we need to get the right information in to ensure that people get get vaccinated and get the information to the people that need it most.
And right now we're averaging about 140,000 new infections per day. Vaccines have hit another wall, falling for a 6-day. What's a realistic end game for the United States, and how far away are we from that?
I think that right now we're at a critical point in the pandemic. We really need to make sure that, as I said, we need to make sure that everyone gets vaccinated, continue to wear masks, continue social distancing and mitigation strategies, and make sure that if we can get to this 85% vaccination rate that everyone is wanting at this point, and also ensure that we practice good social distancing and mitigation measures, hopefully these cases will slow, and we won't have as much of a surge, as we will be able to control the surge. Right now, as it is, at the rate that we're going, this is going to go on for a while. We don't know when this will end. And these are the measures that are needed to impact this from actually going to make this worse in the future. And also, we need to ensure that we vaccinate the world. Right now, all these variants that we're getting, they're coming also from other countries. And we need to make sure that we vaccinate the world in order to ensure that these new variants don't form. We need to make sure we vaccinate within our country, that we don't have more variants forming, which are a great possibility in the future, given we have so many people getting infected right now. So the more more infections we have, the more risk of variants forming that we have as well.
Yeah. All right, Dr. Bhavna Lall, thank you for joining me, and thank you for all that you do.
Thanks so much for having me.